now we're going to move into a section of the program where I would like to introduce Renee Pietrangelo, that I mentioned at the outset, Chief Executive Officer of the American Network of Community Options and Resources. Our acronym is ANCOR, based in Alexandria, Virginia. One of the most impressive things about Renee is her capacity to work across organizations in Washington, D.C., which she does so successfully, and nationally, representing state organizations that are affiliated with your organization from the state level throughout the country. She's also has a PhD in philosophy from Georgetown University, which I suspect is sometimes comes in handy with the negotiations you have to undertake with some of your board members and community agencies. Am I right?
Yeah.
Since 2001, she's been implementing a national campaign sponsored by ANCOR and 7 national disability organizations to address workforce issues regarding recruiting and retention of direct support professionals who support people with disabilities. In 2004, she was awarded the U.S. Department of Health and Human Services Distinguished Secretary's Highest Recognition Award. She has over 30 years of experience as a nonprofit association executive with established expertise in areas of leadership competencies and development and education and training. And she'll do a special presentation for us now.
Thank you. Thank you. I can't tell you how thrilled we are to be here and to be engaged as a partner with this important conference, but more importantly with the important ongoing work of the Coleman Institute and their mission to enhance the lives of people with cognitive disabilities. So I'd like to express our thanks to the Coleman Institute, particularly to Dr. Braddock, to Claudia and Bill Coleman, and to the Turner family. They've just been generous supporters and an avid partner and friend of the community supports and services providers, and we very much appreciate that. I'd be remiss if I didn't also thank Enid Ablowitz, who's been a tireless facilitator in bringing to reality this vision that we had a couple of years ago about expanding this conference to include an additional venue and opportunity for community providers to come together and dialogue on this important issue. Thanks, of course, to our partner, the National Council on Community Behavioral Health Care. We really commend their vision in partnering with us to craft a national forum to share and dialogue model practice, innovation, and supportive public policy directives in the area of technology applications. I think this conference overall is a testament to the power of partnership, which is your theme here today. I also want to thank our partner in tomorrow's program, additional partner, the National Alliance of Direct Support Professionals, NADSP, especially its president, Lisa Burke, who readily agreed to work with us in crafting the program for tomorrow, and also having a clear and proactive vision on the role direct support professionals will play and their need to be at the table as the roles and values around technology applications are discussed. And thanks also to kudos to the direct support professionals themselves who participated in an Anchor National Advocacy Campaign Technology Contest, submitting their creative ideas about how technology might be applied to improve the lives of the people they serve. And we're going to be sharing some of those ideas during tomorrow's programming. Charles Handy, you may not know who he is, but he once said that most of us prefer to walk backward into the future, a posture that may be uncomfortable, but which at least allows us to keep on looking at familiar things as long as we can. Our partnership is committed to facing forward, not backward, and engaging the possibilities that arise from examining the role technology can play in making the most positive difference for people with disabilities. There's certainly no doubt moving forward that there'll be difficult choices to be made in this process. As with all difficult challenges, they must be honestly presented and framed and intelligently, creatively, and courageously discussed. So the summit portion of this, which will happen tomorrow, that we've incorporated into the Coleman Institute Technology Conference, affords us that opportunity. We all know that we're facing the most difficult economic situation in the history of community supports and services. How do we continue to assure quality and translate the values and outcomes for which we advocate to serving more people in more and more decentralized virtual environment with less overall funding? That is a big question, and one that we're up to the task of discussing and addressing, and we believe that technology is going to play an essential role in answering that question. These answers are also going to require collaboration on a scope and scale unparalleled in the past, and of which this unique collaboration is indicative. The bottom line is Anchors and its member organizations' deep commitment to assuring that people with disabilities don't just get supports and services, but have good lives of their choosing. Once again, technology has an essential role to play in facilitating and supporting that important outcome. And it's now my pleasure to introduce Laura Galbreath, the Director of Health Integration and Wellness Promotion with our valued partner, the National Council for Community Behavioral Health Care. Please welcome Laura.
Pleasure to be here with you today. We're really excited about this ability to be a new partner with Anchor and the Coleman Institute, and to be here today. I think it's just amazing the stakeholders that are here. It's something that you don't see very often, as we're a provider organization. So we've got 1,700 members that are providing mental health, substance use, developmental disability services across the country. It's not very often that we get to come to a meeting where we actually get to talk to researchers that are doing really innovative things. Entrepreneurs that are creating these new technologies, and then the families and individuals that are actually going to be utilizing these services. So I think it's the kind of conversation that we need to have at a really broader level that we're really excited about. I think there's a lot of changes in the delivery systems, but I think the conversation that we're having here today and the conversation we're going to have tomorrow is really aligned with what's going on in a broader scope. Personalized medicine, prevention, and the redesign of kind of public health, person-centered medical homes. This overall reality that we are not just defined by our disability or our level of health status, that we're complex and that we bring lots of things to the table, really demands a different way of providing services. So we're very excited to be here as part of this critical conversation and to build these partnerships and to support you in the work that you're doing in the communities at that level, as well as what needs to be done at the state in terms of financing and other changes that will be occurring in these next several years, as well as on the national level, to make sure that for people with cognitive disabilities, their needs and this technology that we're really exploring is embedded right along with all the other technology changes that we're going to be seeing. So it's an exciting time, it's a challenging time. We look forward to these conversations and engaging with you today and tomorrow, and look forward to just the next several days. So thank you.